You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference in not only how you feel about yourself, but how people react to you. With us, we have an expert on the topic. She is Madison's cosmetic dentist, Dr. Gyurina. Dr. Gyurina, welcome to the program.
Thank you for having me, Randy.
Now, your patients call you Dr. Jana? Is that what you prefer?
Yeah, yes.
Okay. So, for people that don't know you, tell me a little bit about your practice. I guess, who's your typical patient? And what are the different procedures you do?
Well, the procedures we do really are everything,
okay,
for the most part. You know, we do implants, we do cosmetic dentistry, we do general dentistry, we treat kids, we treat adults, we treat everybody.
Okay. How long have you been there, by the way, in that town?
13 years, almost 14.
13 years. So you've probably dealt with thousands of people.
Oh, yes, definitely.
Do you hear, by the way, because I know nobody likes going to the dentist, right?
Right.
Do you hear that as well? Like,
all
no
the
offense,
time.
doctor?
Except for my friends, of course, because I'm so busy. That's when we get to spend time together in my chair. But for the most part, you know, most people have bad experiences, and they are looking for somewhere that it's comfortable, and they have a relationship with us, and we just have fun. Okay,
so you do just about it. So you do high-end cosmetic?
Yes.
You do just regular general dentistry?
We do.
But tell me about this, and I'm going to have you come on another day to talk about what you do for people with migraine headaches and TMJ.
So I treat many people that have pain, headaches, neck pain, jaw pain, ringing of their ears, tingling of their fingertips, patients that have sleep apnea. So we do, a large part of our practice is also pain patients.
Okay.
And then a large part is cosmetic dentistry. You know, I've developed a niche in that area. And then I do general dentistry, fillings, gingival recontouring, or, you know, redefining the gum line.
You're not the only dentist there, right? You work together with...
I have an associate, yes,
okay,
that works with me. And so we offer root canals, we offer implants, implant placement, really everything. What
do you love most about it? Because you say, we've talked on the phone, you say, you know, some people, I mean, to them it's life-changing. You fix their smile. Elaborate on that. What do you mean by that?
You look at a person, you're really not sure, you know, if they're not happy, if they're fearful of the dentist, if they have a bad job, if they're not happy with their marriage. And sometimes it's simply that they're not confident with their smile. And you fix tiny things. I mean, you could fix someone's gum tissue, you could do some recontouring of their tooth, and they start smiling suddenly, and their world opens up.
Can you spot people that don't like their smile when you're out and about, people that are hiding their smile?
Well,
can you spot it?
I can, yes. Because they don't really smile unless they're forced to smile or you make them laugh. My husband's a big jokester, so we're out and about, you know, he tends to make people laugh. And then I'll see something with their smile, and then I know immediately, gosh, you know, if that person only knew that they could just fix that one thing, it could open up their world. Okay,
we're talking about how small improvements can make a big difference in somebody's life. So what are the different categories? And you brought a lot of photos, by the way. And these are dramatic photos. I mean, you got to stick around for these photos. And I also need people to know this is a real interview. I mean, I'm not trying to endorse you or side with you, but these photos really are dramatic. So what are the categories of cosmetic dentistry?
Well, simple things like gum recontouring, you know, evening out someone's smile or the gums, recontouring a tooth, just adjusting a tooth that might be longer than the other. Bonding, cosmetic bonding, where you're filling in gaps or creating changes in the shape of teeth so that they're proportionate. Those are very simple, easy things.
Veneers, big part of your practice?
Very large part of my practice. And right now I'm doing many prepless veneers. So I've taken a step back from doing traditional veneers to now thinking about what would I do if this is my child or my husband or my team member, and hardly...
Prepless means that you don't touch the tooth.
You're not touching the tooth.
And you put it over the tooth.
And you put it over the tooth.
But doesn't that give a big tooth look, though?
You know what? It does not. It's the right candidate, of course. You have to have the right person that is the candidate for that.
So for what? People with shorter teeth?
You know, yes. And you look at their profile, and if someone smiles and they have a full lip, you can place something over it and you wouldn't even notice. It's dramatic and amazing.
What about Invisalign?
We do a lot of Invisalign, yes. That's very simple for adults or teenagers. We do teen Invisalign. We're correcting, you know, crowding issues, spacing issues, bite issues. We do 6-month smiles, which is also an adult orthodontic.
That's like a fast ortho.
It is usually in 6 months, yes. We don't correct the bite or anything in the back of their mouth, but it's more for adults who, they function fine, they're just not happy.
Now you also, I guess, have a lab or a machine. You make crowns right there.
Yes,
like
we do.
on the same day?
We do. It's amazing. It's changed my dentistry. I bought the machine in 2008, and since then, again, I've become much more conservative because you can keep the remaining tooth structure there and bond onto that, which is extremely strong.
So when I hear crowns in a day or teeth in a day, this is what you're doing?
Exactly. That's exactly what I'm doing. And people love it because they have no temporary crown, nothing falls off. You know, a lot of my patients travel to me. They aren't necessarily in Madison, but they're in, you know, outer-lying areas. And it's a pain. If a temporary falls off, they have to drive in an hour, hour and a half. It's just not convenient. So this way, it's all done in 2 hours.
So how it's normally done is how?
Normally, you prepare the tooth for whatever restoration it needs. Well, normally you're gonna have to do a full coverage crown. And then you make them, you take an impression, which a lot of people hate because they can gag. You take an impression, make them a temporary, you send it to a lab. I use a lab in California, Williams Dental Lab. They're amazing.
Okay.
So then you would have to wait 2 weeks, and you have a temporary for 2 weeks. If you floss it, it could pop off. If you chew something, it could come off. So the same day crown really is just done.
Just
so
all right there.
You leave the office.
Because nobody likes going to the dentist back and forth. So you brought some photos. Let's go to the photos. What do you have for us?
So here's a patient who was a patient of my practice. He had a removable partial denture, very short teeth, worn down, overclosed bite. And so what that means, Randy, is just from grinding over time, his teeth became shorter, and then his dimension from here to here became almost smushed, smaller, if you will. Yeah. And so options for a patient like this really is to redo the partial. The minimal would be to redo it so it looked more natural, maybe add a few crowns. You know, what you look at is you look at his smile line. It's almost reversed. It's not a smile. I mean, he's just,
so the upper
he struggles to smile. Yeah, you don't see many teeth at all.
You say you have to force people to smile sometimes. Even at the dentist? I mean, you're the dentist and they don't want to smile for you?
I have to ask, please smile, and they, you know.
Okay.
Yeah.
So when you see this, and we were talking in the green room, sometimes you get excited, you say.
Or
you can see the end result.
I get very excited. Yeah, because I look at him and I can just picture in my mind what it could look like.
Okay, so what did you do for him?
So what I ended up doing for him was 2 implants in the front 2 teeth, and we did a neuromuscular bite on him, which is changing his bite so that all of his muscles are relaxed. He's not going to grind anymore, and he's going to be at physiologic rest, really, so he's not going to be grinding his teeth down anymore. So when you look at his after, you can see how much the difference he has, again, in proportions.
That is a big difference.
So you look at, and you wouldn't know this, but what I look at is the nose to the chin and how it's lengthened. And by lengthening it,
that's a good point.
It's almost like a little plastic surgery, because anyone that has wrinkles here, you know, you're opening it up so that the appearance is different. It's where it should be.
So what does he say when it's all done? Like when he sees it in the mirror for the first time?
He just couldn't believe the difference it made and how much younger he looks.
It does. Yeah, he looks younger.
Looks 20 years younger. Just a much more youthful appearance. You know, you can see his teeth. His lip line follows nicely around the teeth.
Now, are the patients getting older and older that are coming in, or younger and younger for cosmetic dentistry?
Both.
Why do this in this kind of an economy? Why invest in your smile? What's your take on that?
Well, you really have to invest in yourself, because if you invest in yourself, I mean, look at health nowadays. I mean, everybody's getting healthier. They're eating healthier. They're talking about all these different diets and all this different, I mean, the more active lifestyle, and it's going to make you, you know, appear younger, and you're just more youthful. Same thing here. You have to invest in yourself, or people want to invest in themselves, I should say, because it changes their life. I mean,
well, definitely, you know, the perception. I'm looking at this and I'm trying to think, how would I judge him before and after? If he were on a job interview.
Exactly. Would you want to hire him or him?
Yeah. I mean,
who would you want to run a company?
Yeah. Well, you definitely hire somebody that looks positive.
Absolutely.
Looks healthy, with all things being equal.
Well, I always say we hire in my office for personality. I can train someone to do something, but it's personality.
Is it about 50-50 men to women, or more women?
Well, it used to be way more women, and now men are catching up slowly, because
real men are coming in for cosmetic dentistry?
I think half of these pictures are men. Yes, definitely. Is that right? Definitely. But I do have a female here I'd like to show you.
Okay.
So she came to me actually with headaches, pretty severe headaches and neck pain, but she didn't like the existing crowns she had and didn't like the color of her teeth. She almost had a little tetracycline stain. I don't know if you ever noticed that, where it's a little browner.
Yeah.
It doesn't whiten at all. You can whiten all you want, but it won't change the color. She thought she kind of had a little bit of a gummy smile as well. Okay. So for this patient, we did a full mouth restoration, where again we did neuromuscular dentistry on her, changing her bite. Not always the case for everybody, but it just so happens.
How the teeth come together, by the way? It's very important to you.
It's more important to me than anything, actually. Function is more important to me than anything, yes.
All right.
So now, I mean, she just smiles all the time. Gorgeous, very natural color. You know, we use 3 different shades, so it blends in nicely, and it doesn't look fake at all. It's extremely natural. You wouldn't even know.
So she's got to be thrilled then, when it's done.
She is thrilled. I mean, I have many patients who will, you know, they'll have tears in their eyes when we're done, because they've never been able to be confident and smile, and they're numb, and they're still smiling, and they just can't believe the difference. And even the temporaries people talk about, because for this type of work, you have to have temporaries. I sent it to a lab in California who does all the work for me, and their temporaries are amazing.
So if a patient goes to you, and how much say-so do they have in what the final result's going to look like? I mean, how do you tell them this is what your teeth are going to look like? Do you do it through imaging or what?
You know, it's interesting you say that, because the majority of people let me do what I feel is right, because I've been doing this for so long, and
okay.
They just trust me.
They say, Dr. Jana,
do anything, yes.
Okay.
They'll say, you know, I don't like the length, or I don't like the width, I don't like the gums. And I really look at I have them stand up, I look at their proportions, and I don't just make a one-size-fits-all. It's very specific for each patient.
Okay.
So what I tell patients is, if they have input, please give it to me, because I want to know. Some people bring pictures in from when they're in high school. See how long my teeth are? I want my teeth like this again.
All right.
So that's really fun. But the process is, we do models and send it to my lab, and they give me this wax up. Mm-hmm. And that stent that I put in after the teeth are prepared is what the finals are going to look like.
So you give them like a temporary smile?
Exactly.
Oh, so they can see what it's going to look like.
They can. And then they can give me input. I love this, or can you shorten it, or can you lengthen it?
Do they normally say I love it?
I hardly have to make changes.
Now you have pictures on your wall, you were saying?
I do.
Where they point, I want that?
I do. So we have many patients who don't even know what I can do for them. Just the general patient.
Yeah.
So throughout the office, we have after photos of many cases that I've done. So they'll say, I love that. Can you do that for me?
Did they ever say they want your smile? I mean, you have a world-class smile.
Oh, thank you.
Is that natural?
It is. It is.
So you were just lucky?
I had braces.
Okay.
Yeah. But my teeth, I mean, I could definitely use some work on my teeth. They're not perfect.
Oh, they're not? They look, even though they look perfect, they're not perfect.
Oh, they're not, but yeah, they're not, but yes.
Okay, good. But so they do say, I'd like that kind of a smile.
Yes, they do.
And, well, you're a dentist, and respectfully I say, I mean, of course you think the smile's important. How important is it?
Well, gosh, if you pick up any magazine, one of the top 3 things is always smile. Men's Health, Vogue, Cosmo, and Style, any magazine, they're going to say the top 3, one of the top 3 things.
What you look for in a...
Exactly, thank you, is a smile. It's one of the most important things. You know, another point I'd like to make, Randy, is that if you have 2 people interviewing for a job,
okay,
one of them smiling, one of them not, who are you going to hire? The one that's more confident, because you know they're going to probably get the job done.
Yeah, I mean, there's no doubt about it. I mean, when you go to, you know, even with restaurants, it's noticeable when the waitress gives you a teeth smile.
Yeah, or you see people at a party. Who has more people around them? Who's having more fun? The one that's smiling.
The charisma.
Yeah, absolutely. Let me show you another picture.
Okay. You're showing these like baby pictures.
I love it.
I'm picking up on the fact that you're kind of proud of this work.
And you know, these are really old cases. I have to apologize. I haven't had a photographer come out recently and take all, you know, photos of the last couple years. So.
Okay, good. And hopefully you have their permission.
Of course I have their permission.
Okay,
yeah.
good.
Yes,
okay,
yes.
Here's a guy. He looks like
they're
a
on
friendly
my wall, so yeah.
He looks like a friendly person.
He is great. Yes. So he, you know, was an existing patient and wasn't happy with his smile, and he asked me what he could do. And of course, braces are an option. Bonding's an option. Although bonding's a little tough when you have a big space like that. You know, we talked about all those options.
So they come in and confide themselves in you, by the way?
Yeah, I mean,
like sometimes, like you're the psychiatrist. I mean, do they really
tell me everything? Yes. Mm-hmm.
So the space is what bothers you.
And that's how I'm building relationships with people. You know, they share things with me, and it's just a bond.
Okay.
You know, so he really wanted something immediate. He didn't want to be in braces for a year. He didn't want any metal brackets. So for him, veneers was the best choice, and that's what he asked me for, was veneers.
So when you see this, do you think this is really going to be good? This is gonna do you tell them that? Do you say, "Oh boy, this is going to be good"?
Oh yeah.
Like, how do you say it? What do you say to them?
So, you know, the difference is going to be unbelievable. It's just going to be unbelievable. And, well, tell me what you think.
Wow.
Yeah.
Not even the same guy.
I mean, he looks younger. It's more youthful. He's smiling all the time.
He's handsome in the after. Not that he wasn't handsome before.
He's very handsome, yeah.
But it is a big difference.
Yeah. It really is. And then I have this woman here.
Okay.
Who came to me as a consultation saying, I have my high school reunion coming up.
All right.
And I don't smile. And I want to be able to smile. Similar situation where she had that space. She came to me wanting veneers.
Yeah.
And I mean, just smiles all the time now. Very happy.
Very nice.
Changes her life because, you know, she had those teeth her whole life, and she went to her reunion and
they look natural.
Very
I mean, good for you.
Well,
do people tend to do this on an occasion? Getting a divorce,
yes.
Getting married?
Yes, going on Match.com now. I just had a patient recently that I finished a smile makeover on, and she said to me, the number one thing that everybody says to her on Match.com is, "You have the most beautiful smile." And she was going to try to cut and paste all these comments from men because she wanted me to use it for marketing, because she's just she's so over the moon about it. But that's a fun story.
So the smile is important. And you're probably thinking, this is what I'm always trying to tell everybody. The smile is important.
Well, yes.
Yeah. Well, good for you. Good for you. So it's younger, it's older. And
it's everybody. It's high schoolers. I mean, it's everything. Senior pictures, you know. Of course, wedding. But
now,
yeah.
how much is art and how much is science?
Well, it's equal, really. It's so artistic. I mean, we look at dimensions and proportions, and Da Vinci and the Vitruvian Man, and we really look at everything.
And we should mention too your training, by the way.
Yes.
You went to this Las Vegas Institute,
LVI, yes.
which I guess what it is to dentistry is like what Juilliard is to music. Dentists from all over the world, you say, go there to learn this art.
It's an amazing facility.
Is there that much to learn, though, really?
It's endless. I mean, I do 100+ hours a year in continuing education, because really it's just constantly evolving.
So do you think you obviously have to have an eye for this?
Yes.
Like any art?
Yes. Yes. You have to be able to, as you asked me before, you have to be able to visualize it without even having impressions or...
Prior to you coming on the show, I always think, okay, veneers, and they look obvious and they look big. You're in Wisconsin, we're in L.A. and Orange County and San Diego.
It's a little different.
And
Wisconsin.
We see big teeth here.
Yeah.
Is that the dentist, in the hands of the dentist, or is that the patient? What's your take on that?
I would have to say it's probably in the hands of the dentist. Yes, definitely.
So your goal is where nobody knows. I mean, what is your goal when you're?
Most people don't want to know. I mean, most people don't want to tell their friends even they're doing it. They just want someone to know that there's a subtle difference with something, and many people don't even know. But some people tell their world what they're doing. But yes, it's very different. But we want it to be very natural. And so I help coach people into a shade that really works for them. Now I have people that want really, really white teeth, but I try to tell them that white to you, in 10, 15, 20 years, do you really want to have really, really white teeth?
So too white is a bad thing?
Well, it's fake. Too white looks fake.
Oh, interesting.
Yeah, it looks fake. And I've done that because people have wanted it, but I don't,
You don't what?
I tell them not to tell anyone that I'm their dentist, because it doesn't look, it's just not natural.
So don't
and
go
I want,
too white.
I want it to be natural in appearance and not too big and all the,
All right, so what is the turnaround time? In a perfect world, okay, somebody who's watching this, they don't like their smile, how soon can the turnaround be?
Usually 2 weeks. I can rush it if I need to, but it's usually about 2 weeks time.
2 weeks? Mm-hmm. Does everybody meet with you if they want to? Because I know you have an associate.
Oh yeah, I do all the cosmetic dentistry, yes.
Okay, so you do all that. Okay, so you have other photos, and we're just about out of time.
Yes.
Good stuff. Good stuff.
So this is a great case. This patient came to me actually for a sleep apnea appliance, which we're going to be talking about later. I said, smile, and that's what he did. I said, no, really, smile.
Is that right?
And he said, this is my smile.
A lot of people smile like this, do you think?
More men don't, smile, because I think a woman's just gonna, if someone asks you to smile, they'll smile, maybe reluctantly, but they'll smile.
So that's his smile.
Yeah.
Okay.
And so here's the after. Yeah, just
Very
now he
nice.
smiles all the time. This is the patient smiling.
Okay.
This is him smiling. But you see people like this everywhere you go. And you wonder, are they serious? Are they upset? What's going on in their personal life? They're grumpy. But it's just because they're not happy with their smile or confident enough to smile. They don't even think about it. They just don't do it.
So he's like a smile makeover kind of a...
He is. That came to me for snoring, and now we've fixed both things. But yeah, and that too, of course, his wife is elated because now he's smiling more, and you seem
when you
obviously
smile more, you're
happy.
happier,
Of course,
right.
yes. So he was very happy before, but now he's really
and veneers
happy.
don't stain. Is that right?
Correct. Veneers do not stain. Back to what we were talking about before with Hollywood and how you live in California and everybody has big white teeth.
Because I always feel like I could spot them.
Yeah, but most of the actresses have veneers, but they're just done really well.
So you can't notice them.
Right. But
so
there's
good
some that
veneers, nobody should be able to know.
Absolutely. At all.
Now, do people travel to see you sometimes?
Yes, I have patients, 1 to 2.5 hours away that come, and then they'll coordinate, a cleaning with maybe shopping in the area or something. Here's another patient I want to show you.
Okay.
So she was unhappy with the crowns she had. There's
All right,
metal. There's
all right.
metal along the gum line. So when she smiles, it look like she has dark gums. Her laterals are shorter. Her canines are a little too pointy. So she just wasn't happy with what she had.
Again, this is one of those where you say, this is going to be good.
Oh, absolutely.
Like in your
I can
mind,
tell
what are you thinking?
Absolutely, this is going to be amazing. Yeah.
Okay.
And I always use that word, but it's so
Do you
true.
ever go home, you're excited about this?
Oh my gosh, my husband's like, honey, we have the kids here. Quit,
Talking about...
Yeah, because I love it. I'm very obviously.
So you go to dinner sometimes and you talk about it?
We talk about it all the time. I feel like I'm always working, but I love what I do, so it's okay.
Good for you.
Yeah.
Good for you. Okay, so this woman, for her options were what?
Her options were just to replace the 2 crowns that had the metal, whiten first.
Because metal was what? Showing?
You can see it if you look at the gum line. It's just a little grayish and kind of dark.
Like around the top of the tooth?
Exactly, at the gum line.
What is that, by the way?
Well, that's the metal underneath the crown showing through. Or if the tooth had a root canal and the tooth is dead, it's darker, so you have to block it. And there are certain techniques you do so that you can't tell that it's a root canal tooth.
Okay.
So her options were minimal, whitening, and just replace the 2, or whitening, replace the 2, plus do the 2 next to it. And then you can just sequentially go on. But I have them smile really wide and show them, if we only do this, here's what's going to happen. If you do more, so we kind of talk it through. Because I don't ever want someone to be disappointed that they only did 2 and didn't do more.
Okay.
Right? So if you look after, she's, again, just so,
nice.
so different. She's just...
Very nice.
Yeah, she...
Well, she looked like she was smiling all the time before. Like a smiley, happy
Very
person
happy,
anyway.
yes. But she wasn't happy with her teeth, even though she's happy. And again, that's her personality. She's a happy person.
When you say, because we talked about this and I didn't let you finish, but you say cosmetic dentistry is not for everyone.
It isn't for everybody. If you're not happy with something, fix it. If you don't like it, talk to us. There's so many options, from something very small to something more. There's a whole range of things we can do for you.
Because people tuning in, and we're talking a lot about porcelain veneers, but we've also mentioned, off camera, where it's about options, like even whitening or contouring or orthodontist. Do you ever have people that self-diagnose and say, I need veneers, and they really need something else?
Absolutely. And I'll tell them, I'll say, I think, but we should probably do some bonding here instead, because it's just less to do, and it's going to wear better potentially against what you have. There's so many different reasons.
Okay.
Right now I'm going for my Aacd Accreditation, which is American Academy of Cosmetic Dentistry Accreditation, in honor to have this recognition. And so there's really no one in a 200-mile radius that has this or going for this. So this is something I'm going for right now. So I'm taking so many photos and just trying to show people different options, because there's all different types of things you can do.
So when you go to these courses, like you say 100 hours to just learn about all these different things, is it just like little subtle things that could just make a smile pop? Or?
Absolutely. The tiniest thing you can learn can make a huge change. There's so many masters out there to learn from that you just like to hear. I like to hear certain people, and there's so many different things I can do for someone.
So all of these photos, by the way, if somebody's watching this, just tuning in, they can look at all these photos on your website.
Absolutely.
Okay, and we are, I'm telling you, out of time.
Yeah.
Maybe 1 or 2.
That would be great.
Okay.
So this patient here came to me, he broke his tooth.
Okay.
So I think he hit it on a bottle or something, and which happens. He broke a tooth and wanted to do 6 veneers. He asked for 6. I tried to explain to him, by doing more, we're going to be able to fill in that kind of grayness when you smile here. But I did 6, and they still look amazing. He just smiles all the time.
Very
he
nice.
wanted him wider. He's a good-looking guy.
Very nice.
This patient here had existing bridges, so missing a tooth, which is connected to 2 other teeth here. So they're metal. They're pretty old. He wasn't happy with them. He had cavities underneath them, and so we redid the bridges in all porcelain, which I have a metal-free practice, so we have no.
So no metal.
No metal. Everything's
Even
bonded.
for fillings, nothing.
No metal.
You take out the metal if they have metal,
We do.
and if they
Absolutely.
request. Okay.
Oh, I take it. Yeah.
You have special equipment, I hope.
I do. I do. I absolutely do.
Okay.
So here's his after. Just again, a really good-looking guy, but it just brings him up a notch because his teeth look really good. And he's proud of his smile. And here's one last patient to show you. A gentleman in his 60s who was very unhappy with his smile. Just didn't like his smile. Didn't really smile much. And
I'm surprised that you get this age range coming in for cosmetic reasons.
I've had people in their 90s come to me that want implants because they don't want to ever have a situation where their teeth fall out.
Okay.
So
this guy, he comes to you, and what are their complaints? They just
he
want a good-looking smile?
I have
or is it more about eating and chewing?
Both. That's
Okay.
a whole other topic, eating and chewing. But for him, he just didn't like his smile. He didn't like the way it looked. He had ground down teeth. Oh, I wish I had the close-up, but his teeth were all ground down on the bottom, so you could almost see the nerve.
All right.
So for him, we had to change his bite, and he is a different person. He
Very
every
nice.
day every time he comes in, he is just, Dr. Jana.
He looks 10 years younger.
And he
He also
feels it.
looks like he has energy. It's amazing what the teeth can do.
Yeah.
And I'm not trying to side with you.
No,
Because going into this, I was thinking, well, she might be exaggerating. How different, the
Well,
teeth could make that big of a difference.
This is why dentistry for me, I am so passionate about it, because I change so many lives by that. My office does, and people are just, it's so fulfilling to have someone who is not happy about something to be able to be really happy.
Do people ever say that they should have done this years ago?
Yeah, they do, yes. But they're so, and I always say, don't worry about the past. You did it. Be grateful and positive that it's done now.
Is there a certain segment of the population that you'd like to see more of? Like the younger patient,
I think always when you're younger, if you can attack something younger, whether it's your health, fitness, your smile, long term, you're going to be better off. So I really think everybody. I really see everybody.
And there's a lot of people, even with a lot of money, that have older smiles.
They do.
Do you think it's their fear of the dentist? Why they don't do something about it?
It's amazing to me that they don't, because they spend all this money on surgery and their clothes, but their teeth aren't fixed. I don't know if it's.
Do you think it's what is it?
I don't know if their dentist isn't giving them options. Like maybe their dentist doesn't do cosmetic dentistry, or maybe they don't. I really don't know.
But do you ever see people say, boy, because they have great skin,
All
they've
the
got
time.
the bag, the clothes,
Like when
and
we're on
you think, boy, it'd be
vacation
the
or-
final finishing touch.
Yeah, because they're
Really?
yeah.
Good. So final message, somebody's watching this, they don't like their smile. For
know-
whatever reason.
You just come in and talk to me. We can show you so many different options. Again, everybody should, if they're not happy with something, they should fix it.
What about pain? Is pain something they complain about?
Afterwards, no.
During?
No, I guess I didn't understand your question. People ask the question.
All right.
We offer sedation, so people who are fearful, they take a pill and they don't remember a thing.
Okay.
It's a wonderful service for people. It's again, I'm very conservative, so you're less likely to have any complications or pain.
Okay, good. I want to thank you for coming to the show. Very
you
good.
so much, Randy.
Excellent, excellent. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could go to wellnesshour.com and just put in Dr. Jana. You'll find her there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.